Welcome to aminacademy.com. In abnormal psychology, let us discuss about oppositional defiant disorder (ODD) and its case studies. Even the best behaved children can be difficult and challenging at times, but oppositional defiant disorder (ODD) includes a frequent and ongoing pattern of anger, irritability, arguing, and defiant towards parents and other authority figures. ODD also includes being spiteful and seeking revenge, a behavior called vindictiveness. These emotional and behavioral issues cause serious problems with family life, social activities, school, and work. But as a parent, you don't have to try to manage a child with ODD alone. Your healthcare provider, a mental health professional, and a child development experts can help. Treatment of ODD involves learning skills to help build positive family interactions and to manage problems behaviors. Other therapy and possibly medicines may be needed to treat related mental health conditions. Some symptoms. Sometimes it's difficult to recognize the difference between a strong willed or emotional child and one with oppositional defiant disorder. It's common for children to show oppositional behavior at certain stage of development. Symptoms of ODD generally begin during a preschool years. Sometimes ODD may develop later, but almost always before the early teen years. Oppositional and defiant behaviors are frequent and ongoing. These cause severe problems with relationships, social activities, or school and work for both the child and the family. Emotional and behavioral symptoms of ODD generally last 6 months. They include angry and irritable mood, argumentative and defiant behavior, and hurtful and revengeful behavior. Angry and irritable mood. Often and easily loses temper, is frequently touchy and easily annoyed by others, is often angry and resentful. Argumentative and defiant behaviors often argues with adults for people in authority, often actively defies or refuses to follow adults' requests or rules, often annoys or upsets people on purpose, often blames others for their own mistakes or behavior. Then, harmful and revengeful behavior says means and hateful things when upset, tries to hurt the feelings of others, and seeks revenge, also called being vindictive, has shown vindictive behavior at least twice in the past 6 months. Severity ODD can be mild, moderate, or severe. When to see a doctor? Your child is not likely to see their own behaviors as a problem. Instead, your child will probably complain about unreasonably demands or blame others for problems. If you think your child may have ODD or other problems, behavior, or you are concerned about your ability to parent a challenging child, seeking help from child psychologist or a child psychiatrist with expertise in behavior problems. What are the causes? There are no known clear causes of oppositional defiant disorder (ODD). Causes may include a combination of genetic and environmental factors. In genetics, a child's natural personality or character, also called temperament, may contribute to developing ODD. Differences in the way nerves and the brain functions also may play a role. Environment. Problems with parenting that may involve a lack of supervision, consistent or harsh discipline, or abuse or neglect may contribute to developing ODD. Some risk factors. Oppositional defiant disorder is a complex problem. Possibly risk factors for ODD includes temperament, parenting issues, other family issues, environment. Some complications. Children and teenagers with oppositional defiant disorder ODD may have trouble at home with parents and siblings, in school with teachers, and at work with supervisors and other authority figures. Children and teens with ODD may struggle to make and keep friends and relationships. ODD also may lead to other problems such as poor school and work performance, antisocial behavior, legal problems, impulse control problem, substance use disorder, also suicidal thought. Many children and teenagers with ODD also have other mental health conditions such as attention deficit hyperactivity disorder ADHD, conduct disorder, depression, anxiety disorder, learning and communication disorder. How to prevent? There is no sure way to prevent oppositional defiant disorder ODD, but positive parenting and early treatment can help improve behavior and prevent the situation from getting worse. The earlier that ODD can be managed, the better. Now we'll discuss further detail about ODD, some case studies. Case studies illustrate that oppositional defiant disorder ODD involves a persistent pattern of angry, irritable mood, argumentative and defiant behavior, and vindictiveness, often leading to impaired social and academic functioning. These studies highlight the importance of early comprehensive interventions such as cognitive behavioral therapy (CBT), family counseling, and medications for co-occurring conditions to mitigate negative outcomes and prevent the progression to conduct disorder or antisocial personal disorders. Some examples of case studies. Case 1, JLS persistent ODD. JL, from a difficult family background, struggled with academics and forming relationship even into her late teens. Her ODD behaviors served as a coping mechanisms, leading to challenges in community college and interpersonal relationships. The study emphasizes the long-term impact of ODD on an individual's life. So case 2, ends exacerbated ODD in a new environment. Ends ODD symptoms worsened after a family move overseas, with his mother's forceful attempts to at discipline being met with resistance and his father's withdrawal. This case demonstrates how family dynamics and environmental changes can affect the presentation and management of ODD. Case 3, Sophia's preschool ODD. A case study of Sophia, a preschooler with ODD, showed a significant reduction in her oppositional and aggressive behaviors following therapy. Improvements were seen in her emotional and behavioral functioning, with parents reporting increased confidence in their ability to manage for future challenges. The Bobby brothers' hostile behavior. Walker and Texas Ranger, two brothers, exhibited symptoms consistent with ODD, including constant defiance, arguing, and deliberate annoyance of adults. Their actions were often cruel and unnecessary, demonstrating a need to provoke others. Key themes from case studies: impaired functioning. Individuals with ODD often experience difficulties in school, work, and maintaining friendships due to their argumentative and defiant behaviors. The oppositional defiant disorder (ODD) results in impaired functioning because the persistent pattern of defiant, disobedient, and provocative behavior leads to significant disruption in social, academic, and occupational areas of person's life. Individuals with ODD struggle with negative interactions with adults, peers, and family members, often facing school difficulties like suspensions and difficulties in their relationships and careers later in life. Treatment, often involving parenting interventions and family therapy, can improve outcomes. Comorbidity. ODD frequently co-occurs with other conditions such as ADHD, mood disorder, and anxiety disorder, which can complicate treatment. Treatment approaches: behavioral interventions. Cognitive behavioral therapy (CBT) is effective for improving problem solving, communications, and impulse control skills. Family counseling involving parents and family members is crucial for improving family interactions, social skills, and communications. Medications: while there are no specific drugs for ODD, medications may be used to treat co-occurring conditions like anxiety or mood disorders. Developmental trajectory. ODD is often precursor to conduct disorder and, in some cases, antisocial personality disorder, highlighting the importance of early interventions to prevent more severe dysfunctions. Environmental and family factors, family dynamics, parental discipline strategies, and the environmental context can significantly influence the expression and management of ODD. So far, we discussed some detail about ODD. That means oppositional defiant disorder, some case studies. We have done. Please subscribe our YouTube channel.